I really come back to home and realized that I was with the virus in my hand. uh, the beginning of the pandemic, when it was pretty serious, but I can't think in the serious thing. Just we have the sensor to analyze this in our
Mhm.
lab.
We can talk. Welcome,
Okay.
Lee. Hey, it's really cool to have you on the show. So I'm really excited.
Oh, thank you very much. I'm honored to be here. So it's a great space to discuss science, technology, and everything in this world. I've listened your podcast, so it's amazing to be here. It's a
You
pleasure.
can just be really thanks for that. So I let me start with a confession first. I'm not sure if I confessed to you already, but being a physicist, wandered into biology. In my past life, I was in doing electrophysiology myself, and I avoided chemistry. Actively avoided chemistry. I dropped out at school
You're
in
not the
chemistry.
first.
I stopped chemistry, and now once you shared the material, I really know that I'm regretting it a bit. And I think it was an error. And I think you're exactly the gap that I ducked. And when you shared the material, what you did at UNESP, is it pronounced like this? UNESP in Sao
Unesp?
Paulo?
Yes.
UNESP, yeah. Um, what I found interesting is two things. So the one thing is this tunnel coherence claim at the electrode level. Yeah, that apparently you have wet things. It's warm, it's messy, and still, I mean, it's in blood, it's in plasma. I mean, plasma. And for the physicist, it's not sun plasma like a fourth state of matter. It's plasma. It's really clear. And so this is the one thing. And what the other thing is this paradigm shift where I read in your material that you have this pseudo capacitance, which was in principle a misunderstanding between the old-fashioned chemist and the hardcore other guys, so the electron guys. So and apparently people came up with a topic to explain it, which might have been not the very most accurate one. But in there, coherence plays a role, and I think you just heard it in the introduction jingle. I have my own working hypothesis. It's really a hypothesis that health is coherence. So I'm not sure if we can touch this. So maybe we can park this as a thought where we go. But before we go in these, I really want to learn from you. You have been in university. You did all this, and then at one moment in time it clicked. So in principle, you licked blood, literally. Um, can you tell me a bit when this was, and did it
Uh,
does what you do still taste like physics?
yes, of course. So I'm a chemistry, master degree, PhD, postdoc, also chemistry, but also jumping between the classes. I start chemistry, and in the end of the first year, I was invited by a professor to join his lab at the university. So it was my first year and join the lab to do what? And then he invited me. He showed me his lab. It's like an amusement park for a scientist in in the first grade. Oh my gosh! And then I went. I left for vacation, and then when come back to the city, that was I'm doing my college. I started the lab, and since then I never left the lab. Year after year, I had another project. I had, I think, five projects during college. I worked, yes, I worked a lot. I'm not proud of that. Okay, I know I'm like a workaholic, but I like it. It was really, really nice. All my vacation was inside the lab. And I worked with physical chemistry. I developed hydrogels for drug release, controlled drug release in the body. And this was a very nice project. And then when I finalized college, I started my master's in the same area. I keep
Mm.
doing the hydrogels based on polysaccharides to deliver drugs
Mhm.
uh, in the body. After master, I think I stopped it after years and thought, oh my god, what I should do now? And then I start a PhD.
What else?
I changed completely because a very nice friend and professor at the university told me, why don't you try work with other thing? Maybe we're working so much time with the same thing. I have a suggestion. You can talk with this professor. He's an expert in carbon materials. Maybe you can join the team and develop a great thesis. And I go to this professor, we talked, and the thesis was about graphene.
Graphene.
And
Yeah.
then, yes, and then my macroscopic world, my hydrogels became one layer, made one atom that is graphene. And then during my postdoc, I built graphene. My postdoc, sorry, my PhD, I start a new route of synthesis of graphene.
You
So I,
synthesize graphene.
yes, yes, it was a new route. Yeah, it was a new route. And oh my gosh, what is this material? And now I have to build them, to build it. And okay, let's do this. Let's try to do this. And then I started studying about these nanomaterials, nanotechnology, this nano world. And my thesis was a really nice place to be because I started talk I'm a chemistry, PhD, college, masters, and everything. But but I was in physical chemistry in my masters.
In?
I go to physical chemistry in my masters.
Ah, physics.
Yes, and I go to inorganic chemistry, nanomaterials, specifically chemistry. And during my thesis, I have to work with organic chemistry because I had to describe the mechanism of the synthesis of graphene. It was a newest way to provide graphene. And then I go to the organic chemistry and I go back to to energy because after I built graphene, I I applied this graphene to know if it worked and worked for energy, uh, capacitor, supercapacitor, just an application about this graphene. And then when I finished my PhD, I saw an opportunity to work with graphene, but in a different way, in another university, in another state. In now, I will change again the area, the material, not the material this time, but the area, the supervisor, the state, the city, everything. And then I went to France with my husband uh, because he was doing his PhD. And I was invited to join a lab there to work with energy. And then I go to the interview, I like it, and I think, but there is a dead spot in Brazil. And I'm really interested in know about it, what this group are doing. And then I talked with my husband and told him, no, I'm not staying in France. I go back to Brazil. Let's try.
Let's try.
He told he told me, okay, let's go. And then I changed it. I moved to this new state, this new city, and start work with graphene in a different way. Fun fact: when I arrived to the lab, I had to buy graphene. After 4 years synthesizing graphene, I bought graphene. Oh my god, so much easier. Just a click and the graphene was at the lab.
Yeah. Well, yeah.
The- and since it takes time
Yes.
to give the real graphene. And then I discover a new way. I have opportunity to be in contact with the quantum electrochemistry.
Hmm. Hmm.
And then it's a theoretical group that I joined. So I was in physical chemistry group. I go to the inorganic nanomaterials group, and then I jump to a electrochemistry group, but a theoretical one. Okay, let's try to do this again. And my supervisor was amazing. He was super patient and explained everything about the theory, the quantum electrochemistry, and I start apply this theory on graphene.
And the graphene thing is quite special, is it? Because it's just only carbons, and then you can really improve conductance of whatever other metals, right?
Yes, it's only
Yeah.
carbon, and we start work with pristine, carbon pristine, without
Hmm.
any defects in its structure. So it's the perfect one. And the first work that I developed there was to analyze the quantum properties of graphene applying electrochemistry. And I started studying the several ways that people around the world evaluated the quantum properties of graphene, and then I applied the electrochemistry. It, uh, and work it. And work it, we could access the quantum properties of graphene applying electrochemistry. And this was amazing. Oh my gosh. Um, at room temperature, using a solvent in a fast way, very fast way to obtain. And I thought, oh my god, this is the right place to be. But it's time to apply. It's time to apply. And the applications of this lab is based on analytical chemistry. So, I'm not a chemistry into the analytical area. I always prefer the others, but now I have this in my hands. And we applied graphene as a sensor. At the same time, the pandemic starts. It was 2020. And
Everybody
sorry?
has COVID.
Yeah.
Everybody has COVID tests in their nose.
Yes, everybody has COVID test, and we have graphene working in a different way to sense. And let's try to do this. Graphene worked quite well. We can access the quantum properties of graphene. Let's try. And we go to the lab, take the virus in our hands, and test it with our graphene sensor and work it. And work it very well. We can compare with PCR, that was the gold standard equipment that people are evaluated the samples, and it was a real sample, not a commercial sample. It was a nasopharyngeal samples, and I realized, oh my god, this is real. This this is not just a paper. this is this is really happened. This is really happened. And then I think at this moment the game changed as an academic, that only publish paper and do their research and analyze and triplicate it to have a good result. Now I'm sensing a real sample, a very complex sample. And this was amazing. The feeling, uh, it was incredible. I really come back to home and realized that I was with the virus in my hand. uh, the beginning of the pandemic, when it was pretty serious, but I can think in the serious thing. Just we have the sensor to analyze this in our
Mhm.
lab.
And
Yeah,
you could sleep, or did you just? I mean, it really depends if you detect some things that are, I mean, brilliant by chance, not by chance, but kind of chance. I mean, by purpose, but still
yes,
still that it worked was maybe surprising, and then you can just react. Well, I knew it, or you can just not believe it, or I don't know. Did you discuss with I don't know your friends or your mom or
Oh yeah. Oh yeah. I was very excited. I can believe it that we could do that. Of course, we are sensor commercial molecules in our lab all the time. But when we apply in a real world, it's it's
a
huge.
bit different?
It's
Yes.
huge.
Yeah. Yeah.
It's this is incredible. Incredible.
Mhm.
Yeah, I can't
Yeah.
sleep.
Just for our friends who listen who are similar like me and have no clue about chemistry. So the really cool thing is in principle that you were able to just sense in principle single or very low concentrate, in this case I guess a virus, yeah, with pure without any help. So you don't normally if you do lab tests you need PCR or whatever. So you have your material, then you do a bit of magic that the material binds to something else, and then you have a secondary effect like a light shines somewhere, or the frequency of the light is changing, and you have very complex methodology to detect this, where you need a lot of material, and then eventually you get a signal that is correlated to your original material. But you in this when I read the paper correct, so you have in principle this gold foil was this already with a gold, and you have the graphene on top, and then this binding forest of molecules who reach out, and then you grab this. Was this already this phase, or was it even earlier?
Yeah. This way that we measure it's quite special because we don't need a lot of samples. We don't need a high concentrated, but we can work with high concentrated samples, of course.
Mhm.
But a simple way to measure. And this work that I mentioned, it was with graphene,
Mhm. So it was
but
pure graphene, just okay.
pure graphene,
Mm.
pure graphene, the pristine one, without defects in their structure. And we can, when we work with a mesoscopic regime, less than 5 nanometers, we can access the quantum properties of the material. We work in a quantum regime. Not the capacitance of the system is not governed by the geometric capacitance, but the quantum
Mhm.
capacitance.
of the I always like to call it the Highlander principle. That I mean, you have electrons that are fermions, and then all the complex systems are thing, and then something happens, and then all need to shift around. So is this what you measure in principle?
Yeah, yeah. It's since we can measure the electron transfer between the molecules that we are analyzing, our way to sensing is very sensitive. For example, when we compare with these technologies, these standard methodologies, optical one, for example, as SPR or other that are really useful at the market, they have some limitations because they have to change the refractive index
Mhm.
or something like that. And sometimes it's it's a subtle, it's a small difference to capture this change of the molecule. And then, but when we measure the electron transfer, this is huge because we are working a mesoscopic regime, and each each movement of this electron it's possible to capture by quantum electrochemistry in a specific electrolyte, for example. So when the molecule binds, we capture this by electrochemistry, applying uh, a small potential, a small perturbation at the system.
Mhm.
So we
Mhm.
are able to analyze in a very specific way. And the fact is, we can work with in a complex matrix, such as nasopharyngeal samples, but we can also work in a very dilutive sample. We have a work. We publish a work that we analyze atmolar 10 minus 18 without lost
This is not so much,
active
right?
signal.
So
Sorry?
when I did the calculations, I sometimes I ask my stupid GPTs to just say, give me a layman explanation. So I think it's like what the machine came up with is 1 grain of sugar in an Olympic pool, and then you have one teaspoon. So you have something like 600 atoms or watt per milliliter, and then you go find it. I mean, this is
Yes,
amazing. This is
yes,
in principle disrupting the way we do clinical diagnostics. No, I mean,
yes, exactly. Because sometimes the traditional methodologies fall into the noise, and they are not able to differentiate what's noise, what's a real signal.
mm,
And when we work with the electrochemistry in a quantum way, uh, we can differentiate the noise, the drift of the medium. This is nice. We already analyze plasma samples for detecting Adam 10. Uh,
Alzheimer.
yeah, Alzheimer, yes, it's a
Mhm.
specific target for Alzheimer's. First of all, we analyze commercial samples and we have great results at the lab. And in the end, we receive real samples, plasma samples, with healthy individuals and non-health individuals, and we were able to detect this protein. It's a specific target for Alzheimer's, and we were able to detect this by applying quantum electrochemistry.
I mean, I guess you're not the medical expert, so I'm also not. But my current understanding is so there's a working hypothesis that Alzheimer is happening for whatever things you have plaques in your brain, etc. And then you have the blood-brain barrier, and still you measured. You did not do lumbar puncture, so you measured in plasma of the blood. I mean, so
Yes, plasma of the
there should
blood.
be really a very low concentration to detect this.
Yes,
Yeah.
yes,
Wow.
and it was great because sometimes when we work with complex matrix like plasma, because we don't only have the Adam 10 protein in that sample, we have a lot of proteins, and we were able to detect Adam 10 in a complex matrix
Hmm.
without lose the signal,
Hmm.
and in a very specific way, avoid the non-specific interactions,
Hmm.
because we are really measuring the electrons movement.
Hmm.
And since we modify our electrode with a specific antibody for Adam 10, the bind was very specific, avoiding all the the other species on the plasma that we're not able to detect, to attach. So it's more than key and locker. It's like electron movement. And then when the electrons came to the target, we can detect this.
I, I, I liked your amusement park picture from the beginning because I think this is coming back that in principle so from electrons perspective. So if we anthropomorphize a bit the chemistry, but in principle there is an amusement park in the blood, and then you have this atom attractor,
Yes.
and if you're not an atom thing, you just say, "Oh, boring, I don't go there." But if you are an atom thing, you say, "Ah, I'm going." So this is super attractive in principle for the material, and then you are as sensitive just to open the door that it's really. So you can target it really as a targeted. I'm not sure if it's antibody or
Exactly.
what you take, and then the so this binding. Just out of curiosity, is this permanent or is it just on off? Did you also see on off? Could you measure kinetics, for example?
At this time, we working static. We don't have the system for the kinetics measurements, but we are developing. We are our way to develop this.
Hmm. So you see the wink to the pharma industry. You can, I mean, if you can measure
Yes, yes,
kinetics, I mean,
yes.
this is the whole kind of holy grail. You have to.
Yes, we've been applied this quantum electrochemistry for several samples. We were focused on virus, dengue fever, because in Brazil it's a problem, dengue
Makes sense. Yeah.
fever, and we were able to analyze real samples of dengue fever. After that, we analyzed COVID, real samples of COVID. Um, we studied some anti-inflammatory targets, some targets of cancer. We have a recent work published analyzing DNA of head and neck that detect head and neck cancer. And now we have this study with the neurodegenerative disease, the Alzheimer's one, in real samples. And we have been focused always in diagnostics. But the last 2.5 years, we start focus on drug discovery. We saw an opportunity to evaluate this area because we have been discussing with a lot of people that work with drug discovery, and there are some limitation in the techniques and follow the noise, and they can separate the real signal of the noise of the sample, and they have so much trouble with small molecules and fragments. And small molecules and fragments are really interesting molecules, especially for rare disease
Hmm.
and also cancer, also inflammatory, but especially in specific disease, the equipment has this limitation, and we are trying to solve this problem.
Hmm. Which is a good thing.
Yeah, yeah, yeah. Because it's just a model with the same measurement. We can obtain binding affinity between this molecule, which is important in the beginning of the pipeline for drug discovery. And we also can diagnostic work with diagnostic, a precoce one, because it was one tool for several application.
which is kind of interesting. And the you are part of Qnity, the CSO, the chief scientist or CTO, CSO, whatever, and there is of course a business plan behind it, I think, and this means you might have done your due diligence against comparative things, or what's the strength against the other things. So did you find something where you already have an idea where it does not work better than the others? Because when you work, for example, quantum computing, well, you always say, yeah, there is the idea, once the system scales, we have this algorithm and then everything is good. But today it doesn't work. And eventually even the classical methods are better. So you really have to identify your niche. I think for the sensing, we are in a much more comfortable system landscape, because sensing is you can do something that others can't. But still you compare against other sensors. Can you work a bit on that? Because I'm not sure if there is something that eventually is just cheaper, or I doubt, or quicker, I doubt, but or doing in-stream NMR, whatever, something where you only looking at macroscopic things where the microscopic resolution wouldn't make sense. Did you work on this already, or just out of curiosity?
Yeah. Yes. Let's introduce Qnity, right? After work a lot at the lab, a lot, especially focused on diagnostics, we had in our mind that our science could become a real technology.
Mm-hmm.
And then we start thinking a lot, and we have a IP registered with our applications at the lab, and we were invited to join a venture building in 2023. We were selected. We passed through the program. It was 4 months, and in the end, we were invested by this venture building, and we create Qnity. So even we are working a lot of diagnostics. At this point, we selected drug discovery because it is a huge market that there really needs to work. And then we go to this way in order to avoid some regulators too, because work with diagnostics is quite difficult, and drug discovery does not need this. And I think, could you repeat the question? About the comparison, right? With the other, yeah. Uh, at this point, we made some comparisons with static technologies, because our measurement is only static. So compare our technology with SPR, for example, that measures affinity between molecules. Kinetic, the kinetic is not fair, because probably they go through different results. But when we compare with a static technique like ELISA,
ELISA, yeah.
we were much more sensible than this technique. But now we are working in developing our multiplexed platform, including microfluidics, to start our kinetics studies. This is now our roadmap. Probably in September we have our prototype ready, and then the comparison between this gold standard technique will be fair for Qnity. But I have been compare some results, even working in a different way, and we are working, and we are doing very well. Let's say this. We are doing very well.
Because I think this is one of these topics where I'm lay person in all these things, but I have a little bit of an idea how they play together. So when you do drug discovery, yeah, so you have all these micro plates just for those guys who are not microbiologists, or you have ultra high throughput screening where you put billions of different molecules to show a reaction on your thing. And if I understood correct, so in principle, the sensor is super sensitive,
Yes,
and
yes.
and and so you would just mark against your target for so hit. So if you do if you want to do let's say a lead or identification of a molecule, you would just say, okay, this is the playground where I want everyone to go in who qualifies as a drug candidate. And then you can do very sensitive things with very slow solutions, because if I have my active compound, I might not have a kiloton of it, but maybe just 1 milligram. So I need to dilute it very much. So this is really cool.
Yeah.
And on the same hand, these machines are, of course, drastically rapid in parallelism, because you have these 100,000 micro pipettes, and you just have a you just pour your solution on top of it, and then you do optical readout. With your method, so if you dip your sensor in the solution, it's gone, or can you reuse it and clean it? So you can just
No, we
so you
can
can
reuse.
parallelize it, huh?
We can reuse.
Okay, okay.
Um, we I thought about graphene, but instead of graphene, you can work with other molecules. For example, at this time at Qnity, we are working with a specific peptide, and then we develop this peptide, which is less than 2 nanometers. It's a very tiny one, and we attach this in a gold interface.
And you directly
Elim-
do it in gold
Yeah, in gold. The
without graphene.
peptide without graphene. This we can work with graphene, and we can work with graphene. We can work with gold and peptide.
Okay. So graphene directly without gold, or gold with the peptides.
Yes, yeah. You, usually graphene is on top of silicon, not gold.
Okay, okay, okay.
Graphene on top of silicon and peptide on top of gold. We can
Okay.
work with different. This is another great point. We can work with different platforms. For example, you have a molecule that you want to know the binding affinity between a target. And when I analyze this molecule, I'm not able to attach this molecule at the peptide, but I'm able to attach this molecule at the graphene. So we still solve your problem. So
Which is good.
this is great. We are not limited with only one interface. But and then we have this peptide on top of gold. One of our limitation is that was before is that this gold should be perfectly deposited on this substrate.
So you need,
Because
what are you doing? Are you doing then? You know, there's this thin foil gold things, these foils, but I think they are much too thick. So do you do vapor deposition or what?
yeah,
Okay.
e-beam deposition. We use e-beam. And this is a limitation because this gold should be perfectly deposited. Because if it's not perfect, the peptide will not be perfect on top of that, and consequently, the sensor will not be great. And if this gold is perfectly deposited on the substrate, we can reuse this several
So you
times. Like
clean the forest, the peptide forest or whatever, and then
yes, and you can reuse this electrode more than 10 times without lose
yeah.
the characteristics. This is a cost effective characteristics of Qnity. Because when we compare with gold standard equipment, they are able to reuse only 3 times.
Mm-hmm. Yeah, if at
And we
all.
can,
So normally everything. So if you go in clinics,
yes.
everything is just throw away. Yeah, it's kind of environmental friendly product.
Yeah, but we have to talk about this environmental friendly because sometimes clean the surface is harder than
Throw
get
away
another one
hmm
because
because it's toxic. Or what are you using to clean the surface? Is it?
no, no, it's not toxical, but spend a lot of reagents to cleaning
Ah.
the surface. It's not water, it's not aqueous solution, only aqueous solution. It's an acid solution,
Mhm.
and there's a little acid in the medium. So
But
there
you don't
is.
need these HBR, so these ultra brutal things that you need for cleaning
Oh
your.
no 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 no! We can clean easily.
Like
Yes.
polish your silver at home. Yeah.
Yeah.
Yeah. Yeah, this is. I think I just need to digest it a bit. And um, when I'm looking at this, um, yeah, this forest of proteins that is growing on the gold surface, and you measure this tunnel thing, and you are physicist, you know the Klitzing effect. So you have some natural constant, and then you measure this you measure this constant, that if a current flows in a solid state thing at 0 Kelvin or whatever, you can just directly calculate this. So you can work with the electron as a wave, whatever.
Yes.
And we know that biology is using these things in real life. Yeah. Bird's eye navigation, for example, is working as a tunnel effect. Or photosynthesis is a tunnel effect. So eventually, nature is a bit clever than mankind, but okay, good. It has a bit more time. But
they
um,
they are they are advanced than
yeah,
humans.
a few billion years more. But what I wanted to ask is this is you're measuring in principle these things need to be coherent because you measure some I don't know Dirac equation or whatever. So you have in principle the the interaction only, my understanding question, it only works because you say you have a very perfect substrate, you have a very perfect forest, and then you have something which is binding, and then you can measure the difference of the electrical potential or whatever wave function or statistics of the distribution of the electrodes. With I think you use electric alternating current to define these resistance, and then something is going to peak. Is this right?
Yes, yes, yes. We use impedance spectroscopy to measure this,
That's the
and
perfect term. Yeah.
yeah, and we convert this impedance into capacitance because we don't need label in our measurement, and also we don't need uh, redox elements in our solution because we developed this peptide with the redox probe in the air chain. And then this peptide acts as a linker and a signal amplification of the system. And we apply a very small potential, and we can measure this electron interaction in the surface between these two molecules.
So in principle, you're rebuilding the fundamental sensing thing of nature, because I mean, I'm just thinking, if I have an immune system, so and the immune system needs to know to know what is good and what is not good, and this is also working quite effective. and nobody trained it, so it just grew. And I mean, maybe it's working a bit different, but is this eventually this fundamental mechanism that you detect? Do you think this is this plays also on multiple scales? That you say, I know that now on the individual electron level, I can measure this. So apparently, it's triggering some reaction upstream, which means I'm not sure how to formulate this, but if you talk, for example, with psychiatrists, so the complete other macroscopic, so you're coming from 25 scales bigger, and then you say, so I'm reacting to, I don't know, the signal if my environment is in harmony. So all these terminologies, which are sounding eventually a bit esoteric, but in principle, all the terminology is the same. Yeah, we are on the same frequency. Everybody's resonating with each other, and so. And I mean, there are how many orders of magnitude in between? 18 or so, 20 orders of magnitude in between the electron and the human interaction. Do you think this is linked? I'm just curious. I don't know.
I don't know. I don't have this answer for now. I don't know if there's a coherence between this. What do you mean when you talk about multiple scales?
Sorry?
When you talk about multiple scales, what do you mean?
So the good question. So the the interaction of my self perception as a let's say state vector, I don't know, or my self perception or my prediction machine, where how the environment should interact with myself. So I this what I define my self consciousness, yeah, so to say, is doing some constructive or destructive interference with the outside wave functions world. Yeah. Born to. So, and this is on a very high abstraction level of a let's say super big self-percepting wave function, which in itself is of course worth nothing unless you react with your environment. Yeah, and then if you just say the psychiatrists or psychologists say, okay, we are resonating, or if you play music, for example, in a band, you resonate, you vibe in the same. So if you're swing, if you groove together, for example, so this is a very constructive energy, and then I mean we could even go into this homeopathic where you say the body is an orchestra, and if something is ill, I'm getting detuned, so I'm going out of resonance, and therefore the body doesn't work any longer. So it's Biofields to the extreme, which I find really interesting. But there is no, to my knowledge, there is no classical Western explanation yet. And I mean, quantum physics could, of course, play the role, but we're quickly in the woo-woo. But I don't want to go into woo. So the question is then: so can we learn something from the mechanism that we just discussed? That you say, assume there are these permanent interactions, and the thing is just resonating to say, okay, now I detect there is a difference on the nanoscopic level or ultra nanoscopic, however you want to say. And if this is the same, just on a different scale. So if we know what I'm saying.
I think let me try. I think we are evaluated this interaction between molecules in a very specific way,
Mm-hmm.
like an such a organi- organized way.
Mhm.
And when we perturb the system and we do this movement, the electrodynamics of the electron allow us and the electrons like coupling with the available one,
Mhm.
we are able to measure.
Mhm.
I think I think this is it. This is how it
Mhm.
work it.
Mhm.
We can advance it in our experiments. I think when we start the kinetics measurements. So
Mhm.
we will analyze this alongside the time, and this
Mhm.
will give us a real good information
Yes.
besides the binding between molecules. I think
Mhm.
this will give us more than molecule binding because the electron can go. For now, I think we are working in a very specific way, and this way give us a good information about
Mhm.
molecules, and this way allow us to work at very low concentrations.
Mhm.
And besides the low concentrations, with small molecules, even fragments, and this is because the condition that we work. But I don't know how explain more
No, no,
in.
this is perfect. So, because I think I'm really just thinking. So, what could, for example, my friend who is a psychiatrist, what could he learn from say, wow, I have never seen this. Let's explore. And then you say, it's getting interesting when we measure kinetics. And you say, exactly, because it's kinetics, it's interaction. So the lock-in of a psychotherapist with his patient, yeah, so is on off. Can we learn something from the equations to apply
Yeah,
it in a completely different
when
domain?
we go to kinetics, we can go beyond
Yeah, this would be really interesting.
the
Yeah,
binding of the molecules. I
yeah,
think
yeah.
it will improve a lot
Mhm.
our technology because when the electrons goes to the surface alongside the time will give us so much more information how the molecule acts, not only how the molecule bindings. It will be
Mhm.
more.
Good. Yeah. Let's sit here a bit. If somebody is listening who is psychologist or whatever,
Yeah.
and I mean I just want to dream a bit in the future. What will happen in 10 years? You have an idea? So because you said we will learn. I mean, 10 years is a very long time, but let's really go for 10 years to say imagine what we would do with an internet when we have no internet. I mean, it's nonsense. But I'm nevertheless asking you if your technology is playing out the way we think. Eventually, we detect novel things that we have not thought of. But the let's say the boring traditional 10 years path would be.
In 10 years, maybe it's a lot of time.
Yeah, yeah,
uh,
it's
it's a lot of time. But in a couple of years, I think we were able to. I think not a couple of years, but a couple of months, we will improve our technology
mhm,
because today we are evaluating the binding, how the electrons, the behavior of the electrons when they binding a new molecule or a target of interest. But in a couple, but because of a wrong experiment, I found some opportunity, and
Hmm.
this was great
Yeah,
because when we have some mistakes, we can find novelties. And a couple
yeah,
of
yeah.
months,
Can you please predict your failure? No, just kidding.
yeah, I think so. The answer will not be in 10 years, but in a couple of months, I think our system will be available to evaluate other parameters than binding affinity. Because
Like
when we
what?
analyze like thermodynamics parameters, uh, uh,
Hmm.
uh, there there are parameters in drug discovery like absorption,
Hmm.
toxicity,
Hmm.
um, and others that
Hmm.
are important.
Hmm.
And today they are they are using more like one equipment for each parameters. Or equipment can give you two, three parameters. But we can we can evaluate these parameters from the quantum electrochemistry. So our tech will be able to analyze more than affinity between molecules in the same platform.
Hmm.
So in 10 years, I hope in 10 years, less than 10 years, I hope we
Another
can
country, maybe.
I hope we can provide a platform when we can analyze different parameters for the same
Hmm.
sample.
Hmm.
I think this will be the highest level of
Hmm.
sensor technology.
Hmm. And I like to come back because there's this quantum biology field finally getting a bit more visible, and people working with the terminology of biofield, which means electromagnetic interaction, also subtle and weak, weak energies, and sometimes the weak energies are more powerful than the other ones, which brings us to electrosmog. In kind of, would this platform also allow to say I'm doing this in a shielded chamber, and I do it with earth magnetic field, and I do it with radio frequency, so to measure really the let's say smog, electrosmog or whatever, or potential even electroceutical potential uh, healing frequencies, to say I do electrofrequency, I can do stimulate my vagus nerve, but this is classical electrophysiology. It's just electrophysiology. um, on the electrophysiology on the ion channel, so we are working on that, by the way. But the next level, to say let's go 3 scales down and observe what happens if we can I don't know, increase the off kinetics or the on kinetics by a specific, I don't know, radio wave pulse with nanotesla, whatever, just to, or nanowatts. Would this also work? In principle, it should, no?
It should, but in this case, of course, we can. Since we are working with impedance, we can monitor
Mhm.
the frequency
Directly, yeah.
directly. The
Yeah.
frequency. So
Hmm.
if we can try to translate this
Hmm.
to electrochemistry and the frequency and work with a range of frequency. I've
Hmm.
never stopped to think about it, but I think it's a great opportunity to do that because it's interesting if it work
Yeah.
applying
If
quantum.
it's working. Yeah, and I think that's exactly the idea of this podcast thing at all, because some people say, why are you not doing this? And we could do, we need
Yeah,
sensors to test that. And then we say, yeah, but if we find somebody to sponsor it, and then somebody says, where should I put my billions? So here's the opportunity to put the billions for I don't know, a next
yeah,
challenge
because
that really,
sometimes we are close in our box,
yes.
knowing, oh, I can only apply in this. Oh, with quantum electrochemistry, I can do diagnostics and drug discovery. and we go outside and talk with different people. We can start in other ways to work with the same tool.
Welcome to Entangled Health. Yeah, it's really good that it resonates because I'm testing this. I mean, it's just my hypothesis, but it's
Yeah,
always good
yeah.
if we have people from super domain expertise to say, not fully wrong yet.
Yeah.
Yeah, yeah. So, Lais, another topic. So you are now in a path of your career where you have traveled a lot of countries, lot of personal sacrifices, etc. So you did your lab experiment very early. So so if you now looking and you are a fresh parent, which means you have now responsibility to educate people. I was kidding. No. If or mentor, being a good leader, being a human person and advising to the best. So, if now somebody, a young person, comes and says, "Okay, I'm now 17 years old. I have no clue what to do in this kind of world and all this bad situation. Where should I go?" You have an idea?
um, it's difficult, but it's amazing at the same time. It's hard to grow and pick up, select the way that you want to follow for a long time. I ask myself, you are nothing. Not nothing, but uh, I went to the college to another city, then I moved to another to do my master's, and then I moved again to do my PhD, and I moved again to do my postdoc. And I was planning to become a teacher, and I stopped and start a company. And if I can give an advice for a 17 years old uh, person, it's enjoy the opportunities, enjoy the path, because the process, it's so much more important than the end. And now I'm raising a kid. uh, Thomas has 8 months old, only 8 months old. It
Greetings.
has been quite a journey because I have a startup and I start kid at the same time. And it's amazing because I saw the same way. It's not what my son will be, it's how he will be.
Mhm.
Sometimes when we are younger, we don't know what to do, or we
Yes.
think we are wrong. And actually not. It's just the way to find something, maybe happiness, because in for me happiness is the most important, with health of course, but to
Mhm.
be happy during the journey, during the new discoveries,
Mhm.
during whatever you are trying to do. Be happy and be open, because nothing's wrong. And for a period, I thought, oh my gosh, my friends did the college, the masters, the PhD, and become teacher at the same institution. They have a linear life. They don't have problem. But what's
Maybe
problem?
different. Maybe different problems. Yeah.
Different problem. So my
Yeah.
advice is enjoy, and accept the opportunities.
And
Uh,
yes, and purpose, did purpose play a role, or comes purpose by enjoying? I don't know. I don't know myself.
I don't know. I don't know if I have a purpose. I think, of course, we have a purpose, but I think it's consequence, the purpose,
Mhm.
about what you are doing. So
Mhm.
from we are doing, Go.
by whatever. And then because I mean, because you follow your bliss might be sometimes a bit misleading, but many people on the show said we need to follow our bliss. And I like this because where the energy is, and I'm really undecided if it's purpose, if it's your bliss is driven by purpose, or if your purpose is driven by bliss, or if it's independent from each other. But I don't know. It's just an open,
I think it's independent of each other.
maybe.
Maybe. Maybe this is a good question to spend my day thinking.
It just came the question, so maybe maybe we need to
Yeah, yeah,
think through it.
yeah,
Yeah,
yeah.
I don't know. So, is there something you have uh, missed or are not asked enough?
What I want people ask me more. Uh, Thinking in an experiment, in a technology, I think I'd like to people asking me more why? Why this? Why that? Why? I think the why drive us to the best place when we ask why we are doing something.
Which is linked to purpose. No, I mean,
Yeah, yeah,
yeah.
yeah, for sure.
I have one thing, and you were the perfect candidate because you were jumping countries, etc., etc. I recently had Neil Thies. I'm not sure if you know of him. If
Yeah, I I watch it.
and he was talking a lot about this need to redefine oneself when you're an expat. So you have had this situation quite often. So you you were at one point, then you said, "Well, let's go to France." Poof. So you are nobody when you come there. Then you build your thing and you say, "Ah, let's pack, let's go back." And they do something else. And now you say, "Well, let's build a startup." So in principle, you're jumping identities. How do you do that? I mean, or how does it feel?
Thomas, this is an amazing question because when we was watching the news podcast, I put myself in his place because I I live in Brazil the most part of my life. Then I moved to France for a couple of months. During my postdoc, I moved to Portugal for a couple of months. And now this year I moved to the US. I moved 3 months ago to the US, and I've been spending a lot of time going to Switzerland because of our investors and participate of this environment. And I did therapy, of course, because I should keep myself in the right place. Uh, and my therapist told me, "You are going to a new place. You can be whatever you want to be." Oh, it's true. It's true. You're right. I told him. You're right. I will be a serious person, like a closed person. Different because I'm a very talkative and I like to talk a lot. Sometimes I talk more than I need. And oh no, this time I'll change. But I can't. I definitely can't. I can't become another person. Of course, I arrived here. Some people don't know about my background. Actually, knows. because I'm here because of my background. When I go to Switzerland, the people know because they know my background and they know who am I. But I can redefine myself, Thomas. I
You
tried.
cannot, yeah, you're true to yourself, right? So because this
Yes.
is also, it always comes down. I mean, I had I had this in the company. So when you get a new boss, and then you are yourself, and then you survive all the bosses in principle. So I'm still in the company, but no, and then you adopt a bit. So this was what was meaning in principle earlier with the resonance. So you try to resonate to something, and then you bend yourself and said, but I'm not a fish, I'm a bird. But I can try to be a fish, but in the end, I'm not a fish.
Yes, exactly. I try to be a fish, but I'm a bird. Exactly. Yeah.
If I just want to wrap it up, and I want really to thank you and give you also the last word. So, if where are people going to find you? I think on the internet, on Qnity or something else that you want to share what they should take. Or first way where they want to go, and then what you want to take them, have them take home from this from our conversation.
Um, for this conversation, people can find me at Qnity on LinkedIn as Lais Lopes. I've been around there. And from this conversation, the takeaway that I really like people learning a little about it is that Qnity is developing a new way to know about molecules and health in general. This is a expressive tools that is it is in the beginning, not the scientific because we've been studying this more than 10 years, but the application is the beginning and there so much more to come. And another takeaway is you can try to redefine yourself, but be yourself. It's great too.
Yeah, dear friends, we are now entangled. And that's where we leave it, inside the question. I don't know what this opened for you today, but I hope something did. If a question is still moving in you, sit with it a little longer before you decide what it means. Stay kind, stay curious. Until next time, and keep exploring the unseen.